I always wanted to offer patients natural results. And what I really mean by that is taking kind of what is their essence and just making it better, as opposed to changing them.
That around sometime between 45 and 60 is when you realize you have to do something else.
I think that employing the technologies or Botox and fillers is all about kind of a light hand and balance. Sometimes a patient might be focused on a chin, but they don't see the lip or they don't see the temple.
These things, although we sort of think of them as being vanity, are really key to our sense of self, our confidence. They're really intrinsic to our attitude, the way we feel about ourselves and the world around us. So it's really, really important, and it really can change somebody's life.
And as people are living active lives as they're getting older, that disconnect of, I feel really strong and healthy and good, and I want to look as young as I feel, my role then becomes helping them to connect those two. Sometimes people are in a bind, and if they're thinking about maybe addressing it with surgery in the not too distant future, they should just.
Do you think there will ever be a time when machines replace surgery? Today's guest is Dr. Ann Klausner, one of New York City's best facial plastic surgeons and double board certified by the American Board of Facial Plastic and Reconstructive Surgery. Dr. Klausner is a fellow of the American College of Surgeons and earned her undergraduate degree from Boston College and went to medical school at Georgetown University. She completed her residency at NYU School of Medicine and has consistently been named one of Castle Connolly's top doctors and New Beauty's top beauty doctors. As one of New York City's best facial plastic surgeons, Dr. Klausner demonstrates a commitment to excellence and keen attention to detail. She understands that big and small details, like where you place incisions and how you close them, can make a significant difference. As one of New York City's best plastic surgeons, Dr. Klausner's training and background have given her a unique angle from which to interpret her patients' concerns and present solutions to their aging health. As one of a few select female facial plastic surgeons in practice today, Dr. Klausner is in touch with the modern-day needs of patients seeking natural results. It is the artful use of invasive techniques in combination with non-invasive techniques that gives Dr. Klausner's patients optimal results. This balance of the surgical with the non-surgical helps her patients still look like themselves, only better. Dr. Klausner, welcome to Going Golden. I keep hearing the term healthy aging and well aging. So talk a little bit about your philosophy on aging.
Well, it really started from the beginning. I think every surgeon brings their own aesthetic to their practice. After you learn the foundations of plastic surgery, it is your eye. And I always wanted to offer patients natural results. And what I really mean by that is taking kind of what is their essence and just making it better, as opposed to changing them and making, a nose what it's not. Really, all of those things, need to be, looked upon in harmony with one another, with no one feature really being a distraction from all of the features. Or someone's best assets. So I take that individualized approach with every patient, and it really was very clear to me at the beginning that it would be, hoping to get natural results. And how that's transformed over the years is really words that we commonly hear now of a whole holistic approach, or considering the whole patient. And so with my surgical techniques and also just an influx of all this new technology, I was able to sort of see it as a consumer and see what really worked and what was beneficial, what I would do on myself, what I would do on my mother, and offer those things to the patient. So anything I choose to do, it's really well vetted. It comes with a lot of thought, a lot of research, and really looking at outcomes, not just short-term outcomes, but really long-term outcomes.
Oh, that's interesting.
Because people don't always think about that as, how is this going to look 5 years, 10 years down the road? And is that really good for people?
Typically, would you say that people have, let's say they get a facelift at 50, would they need to think about getting another one at 70 or 80?
It really depends. I mean, the non-invasive, minimally invasive technologies have delayed people's need for a facelift. And I think, though, in some cases, based on facial anatomy, a patient is better served by getting a facelift. And then for some other people, they may have kind of a hereditary ill-defined jawline, and an ultrasound and tightening devices can actually help that person a lot. Whereas their only option at one point was surgery, now we really we can customize things a little bit more.
I've heard a lot of people say you should get a facelift earlier rather than later. It works out better that way. Is there an ideal age to get a facelift?
I think it's really individualized. For some people, it is a good thing, and it's kind of their pattern of aging that maybe the non-invasive, minimally invasive technologies wouldn't necessarily address all of that off the bat. So surgery might be a better alternative. But in other folks, they're not, aging so much, or they're aging in ways, maybe they're losing a little volume, but their skin isn't really sagging that much. And in those patients, you have to do what's right for them, based on what their main concerns are and their physical signs.
I'm curious too, when you sort of made the decision to become a plastic surgeon, like how did you make that decision and why?
Oh gosh, it was really a process, because the first decision was, do I want to be a doctor? And that was a big thing because it's a huge commitment. And it was something I always thought about. For some reason, people always ask me, would you want to be a doctor? And I would say, maybe. But then finally in my freshman year, I came in thinking I would be pre-med, and then after a conversation with my brother, I decided, well, I guess I don't want to be pre-med. He kind of said that pre-med students don't seem to have any life, and college is meant to be fun, and so I dropped out of the classes. But by the time we had exams, I was doing very well academically, but I felt like my life had no meaning. So I rethought that, and I realized I really needed to try. So I started in my sophomore year. And I decided if I loved it, I would do it. And if I did well at it, and if I didn't, I would find something else, but I really did love it and was very committed right from the beginning. And then, I did love anatomy. That was our first class. I really loved dissecting, but I didn't know I'd be a surgeon then. And probably I met a female surgeon. There was like one.
I was actually just going to ask you that question.
Yes,
if there were, few women in
There were very few. And I didn't really mind that in some respects, but I saw someone in my second year who came to lecture. She was a breast surgeon, and I thought, this is really cool. And then when I rotated on that in my third year, I really loved it, and I realized I love that systematic approach. And we have problems, we solve the problem, and it's it's a little bit intense, but then there's resolution, and I really love that aspect of it. So then it was a matter of deciding what kind of surgeon I wanted to be. And in my senior year, my fourth year of med school, I rotated at the Brigham in plastics, and I really fell in love with it. So that was really kind of the beginning, but it was really a process. But it speaks to processes in people's lives, and I think it occurred naturally, and it was a great discovery for me.
So you were meant to do this.
Yeah, exactly. Yes.
Did you think at the beginning you were going to be doing more sort of cosmetic surgery, or?
I did. Because there are some training programs that are more reconstructive, and it's more microvascular work. And I really saw myself with a greatest interest in facial cosmetic surgery. I do some reconstructive surgery, and I think there's overlap in some cases, because even if it's a broken nose or a nose where someone just wants the hump down, some of the principles and the approach are similar. So we want our functional surgery to look good too, so, and Mohs reconstruction and things like that, but mostly cosmetic.
And how long have you been practicing for?
Over 20 years.
Oh, wow.
I came into practice in 2004. So
I'm really curious, because I think things have been changing very quickly in the whole field of dermatology and facial plastic surgery and body too, because we're going to talk about that as well. I'm curious what some of the changes have been, because I think, 20 years ago, we were still seeing people who were like pulled really tight, and talk about how surgery has changed in terms of enabling people to look more natural. And I do think that sort of facial plastic surgery has a lot of art as well as science.
Yes, absolutely. Well, I think when I first came out into practice, there were some new technologies that had come out. And there was a little bit of tension between the surgeons and then, what place these technologies would have. And the purists would say, well, I'm a surgeon, I don't do any of that. And as a young surgeon, realizing that I kind of wanted this old-fashioned relationship with my patients, and that like some patients that I know, and I inevitably come to know my patients, sometimes their children and their spouses and their sisters, and and it's a wonderful experience as a doctor. And that's sort of what I think many doctors hope for in their practice, to have that opportunity. But with that kind of long-term relationship isn't fostered with just surgery, because in a sense, surgery, once it's done, they're off to do other things. So some of the technologies and Botox and fillers, to me, represented a long-term relationship with a patient, that they're not going to need surgery at every moment, but they will need maintenance. And then sometimes surgery will be the solution, and sometimes it will be something else. So I'm really grateful that I had an open mind to that, because as the technologies advanced, some of them sort of fell by the wayside because they didn't do what they claimed to do, but they've improved so much. And we've realized we can integrate them, because the technologies really address quality of skin issues, and surgery really addresses excess skin issues. So sometimes we're resuspending, or we're taking out extra skin with surgery, but we want the skin to look good, and we want to do things that will help it to really be the best version of itself. So really integrating them became a big thing, and it's something that I was very open to from the start. So I'm really happy that I had that perspective then, and I just think it's gotten even bigger now. And I think some of the purists have now come over to our side and see how they can do both. Yeah.
Well, I think it sounds too like you can start with patients when they're younger too, and work with them as they go through the aging process. And there's different concerns at different ages. And I think, because I've been in the beauty industry my whole career, I was very interested in sort of dermatology very early on. I think I'm a little bit of a frustrated dermatologist. But, I started doing Botox and full transparency when I was 30. And I think it's really changed, and lasers and things really changed the way I've aged. And, people ask me a lot, oh, you look so much younger than your age. Have you done anything? Because I look pretty natural. And I'm like, what have I not done? But, I think early on, you're sort of interested in, the injectables or maybe some lasers. But then I will say that around sometime between 45 and 60 is when you realize, like, you have to do something else. Like, you have to take it up a notch. So, like, what are the kinds of things, like, what are your go-to technologies or treatments that you do in sort of those later years, maybe either before surgery or after surgery? And then we'll talk about surgery a little bit.
Sure. I totally agree with you, though, on those levels. And I think that employing the technologies or Botox and fillers, it's all about kind of a light hand and balance. The nice thing about the many options is we did in the beginning, we only had Botox and filler. And so we sort of saw an overuse of Botox and filler. And now we can do a little Botox, we can do a little filler, we can tighten the skin a little bit, and then we can cut out some excess. So it's sort of, we're kind of coming out even in a way. To answer your question about from 45 and up, it is very patient dependent. I always like to begin with what bothers a person the most, because if they have come in for a consultation and they don't get that question answered or that issue addressed, they're not going to be happy. So we begin there, and then based on what I see in that patient, what would create balance and harmony. Sometimes a patient might be focused on a chin, but they don't see the lip, or they don't see the temple, or they don't see, so it's really about kind of finding
that's
a balance.
Where the art comes in.
Yes, and that's where the art comes in, yeah.
That's so interesting, right? Like, I mean, you really have to look at the person and figure out how it's all going to balance and actually make them look prettier, not just younger.
Right. I remember a story that was maybe in the last year or two, but a patient who had been to another doctor and said, I'm going because I want to look better, but I don't like the way I look, and I'm not sure what it is. And I think it was like the focus had been on the lower third of the face always, and they had neglected the upper third of the face. So, kind of finding that balance brought that person to kind of where they see themselves too.
So interesting. I will say for myself and for a lot of my friends, the one area that seems extremely problematic is the neck, whether it's the horizontal lines or whether it's, the sort of what do you call these?
The platysmal bands.
Yes, thank you. Those are the things that really annoy me. Are there sort of machines or technologies that can address that? It seems like you like once that goes, you have to have it fixed surgically.
You have to think about the different components. So the skin, yes, we can improve the quality of the skin with ultrasound. Superficially, soft wave is probably now become kind of the gold standard for a 1.5 millimeter depth into the skin to treat that. Radiofrequency microneedling, and there are many different brands that are very good, but probably the best known is Morpheus, which I have, and that's wonderful because it can treat at multiple levels, sort of like ultrasound ultherapy can treat at the deeper levels, 4.5 millimeters below the skin, which hits the fibers covering the muscle, which in surgery we elevate with sutures. Now we can cause a little contraction of that fibers covering the muscle, so we can tighten it a little deeper than just the skin level. And then 3 millimeters below the skin, which is in some cases is in very thin patients, maybe more of the fibers covering the muscle, and in thicker skin patients might be the deep layer of skin or a little bit of fat. So really guided by the practitioner and the anatomy, we have different technologies that can address those things. I mean, if someone has a focused lax through the neck and they want some short-term solution, threads can be used. They're absorbable and can be effective in the short to intermediate term. I would say, though, personally, that if they're thinking about maybe addressing it with surgery in the not too distant future, they should just do that. Yeah. But sometimes people are in a bind and they're giving talks and being in front of a camera or whatever, and they want something that just has a quick recovery. So it can be very effective for that.
Yeah, true. And for anybody that doesn't know what threads are, they're sort of threads that get inserted into the skin and then sort of pulled. Yeah,
through a needle placed under the skin in the right layer, and they sort of lift the sagging neck to, they have little barbs on them, and they're absorbable. So after about 6 months or so.
I'm curious about this. When you go in and do surgery, can you see if somebody has had threads?
Yes, yeah. And in the original versions, which were not absorbable, in many cases I was removing them.
Yeah, that's what I heard.
But yes, you can.
All right, that's so interesting. And can you do surgery on a neck without doing the face, or do you have to kind of do both together?
You can, but it really depends on the individual and their aging. So sometimes patients are speaking about what bothers them the most, but they're not seeing that they actually do have jowls. And so it's my job to sort of point out that when we lift this, we're revealing the other things that you didn't see so well. But there are some patients who say, that really doesn't bother me, and I really want a short scar, and, I really want a quick recovery, and so we're going to keep it focused. And as long as they're okay with that and what it's going to accomplish, but what it's also not going to accomplish, I'm okay with that. Right. As long as it's not going to do any harm, and it will still do them good and get them to their goals, I'm okay with that. Yeah.
I know we talked about this sort of off camera, but it sounds like the trend, especially just in terms of, people have very hectic lives and they don't want to be down and out for a long period of time, that sort of this idea of the lower facelift and neck is trending. So can you talk about that? Because I know after 50, we all look in the mirror and we pull our face up to know what we would look like if we actually had surgery.
It is, so it all kind of began with a procedure years ago. One that was popularized was called lifestyle lift. It was really just a short scar facelift, shorter scar because it was going less into the scalp and less into the temple. And it was really impacting the jawline and the upper neck. And for many, many, many people, that's really all they need. And one advantage of that shorter scar facelift is that I think that it makes people look the same. I think when they alter their upper cheeks, they can look different. You can see that also with the eyes, the corners of the eyes, when they get lifted. In some ways, they change kind of the relationship of of everything, and people look different. So what's wonderful about that shorter scar is in healthy young patients who don't have a lot of laxity, it can be done under local anesthesia in the office. And in other patients who might have a little bit more work, we can do it under sedation or general anesthesia, whatever the preference is and whatever is appropriate for the patient.
Amazing.
But so that has kind of been the trend, that shorter scar that impacts the hairline less and is kind of stops behind the ear has become very popular for a lot of reasons. And the best reason is that that's what bothers most people the most. So why not just take care of that? And otherwise, I like the way I look and I look like me. And so I'll do that.
Yeah, that's amazing. I mean, I think that's one of the things that is really creating this sort of new look of being just age reversing versus anti-aging and people looking like themselves, just the way they used to look.
Yeah, or just a good, fresh, connected version of themselves. I love when I see my patients out socially, not that I'll ever talk to them.
Exactly.
You know, I always say, don't worry, I'm not going up to you. But when they just look really fresh, rested, and just kind of beaming, you know, like that's really, that they're connected with self in a way, you know, like that idea of helping them reconnect with themselves, you know?
You know, I went to this, I was saying that I went to an aging and longevity conference yesterday at the United Nations. And one of the things they said is that what affects people most is when they wake up in the morning, that it's that first look in the mirror of, you know, how you feel about yourself. And as you age and you look in the mirror, you realize, oh, I feel like I don't look very good, or I don't look like myself. And it kind of sets the tone for the whole rest of the day. And so these things, although we sort of think of them as being vanity, are really key to our sense of self, our confidence. They're really intrinsic to the way our attitude, the way we feel about ourselves and the world around us. So it's really, really important, and it really can change somebody's life.
And as people are living active lives, as they're getting older, that disconnect of, you know, I feel really strong and healthy and good, and I want to look as young as I feel. That's really what my role then becomes, helping them to connect those two again.
I love that, because I feel like what I'm trying to do with, you know, speaking about this period of life is that we all, or most of us, feel the same inside. We still are, you know, empowered and excited and energized and want to, you know, start businesses or travel or meet new people, experience new things, but the outside doesn't look the way we feel on the inside. And therefore, the society treats us differently or starts to box us in. And so I think the fact that science is going to a place where we can actually reflect more on the outside, the way we feel on the inside, is really, really powerful.
I agree.
Let's talk a little bit about body for a minute, because I think, you know, for the longest time, surgery was so focused on face, and now people are really starting to also address the aging in the body. Can you talk a little bit about the treatments that you do most for body?
Yes, I don't do breast surgery, and I don't do body liposuction because I'm a facial plastic surgeon. But in terms of aging skin, there are a lot of very, you know, easier than people expect treatments that can address aging skin, like broadband light. I love broadband light, and it has been shown in series over years to make the skin look younger than it did even, you know, 7-10 years before.
Wow.
They've done biopsies on the tissue, the treated tissue, and they see on the genetic level that it really looks like younger skin. So it doesn't only look younger, but on the RNA level, it is younger. Yes.
So it's like that's something you can use on your knees, or
you can use it on your knees and your arms and your thighs and your abdomen, and there's no numbing. So because it doesn't hurt. So it's and it addresses reds, browns, and crepey skin really. So in series, but if you don't have to numb in the first place and it didn't hurt, you know, why wouldn't you do it again?
Yeah, that's what I'm taking a note that I will need to sign. Where do I sign up for that?
Yes.
I'm really curious what the newest technologies are that you're most excited about.
A lot of the technologies that get introduced and are seemingly new might be just a remake or a modernization of things that are already there. I mean, I'm excited about a lot of things that work well, you know, and continue to work well. So radiofrequency microneedling, broadband light, non-ablative fractional lasers, and ultrasound. I love ultrasound. But ultrasound has been around, since 2008. And what's changed is, one, it's more comfortable. Two, for all of these devices, we've realized we can actually use lower energy levels than we used to use and still get a really good result. So that makes it more comfortable for patients.
What does the ultrasound do? Like, how do you use that?
One of the most common gold standard is ultherapy. And the reason ultherapy is so effective is because it's creating heat wounds at 3 levels.
I will say I've done ultherapy.
Yes,
The most painful experience of my entire life, more painful than childbirth.
Oh, gosh.
Yeah.
Okay,
so I'm glad to hear that they're improving on
yes,
the
well, I mean,
experience.
it's just in terms of a little bit lower energy level, and then how doctors manage it. I use a medical grade topical anesthesia so that and give them Tylenol, and it's fairly comfortable, though it does. But it does work. It does work.
It does really work.
It hurts, but it works. But the lower energy levels seem just as effective. So that's great, and that makes it a little bit more comfortable for people. And the same with radiofrequency microneedling. When I was starting that, the company made recommendations on the energy levels, and you want to make sure somebody gets a good treatment, but you realize you can make it more comfortable and they're still getting that good treatment with lower energy levels. So, and then topicals, mesotherapy, and even exosomes, which are used to help you recover faster and provide, a delivery for growth factors and peptides and things like that, are very good in conjunction with, particularly with radiofrequency microneedling, because we're piercing the skin, and then those are kind of the skin is soaking up those growth factors and peptides.
Increasing absorption. Yes, exactly.
Yeah. So breaking that skin barrier. Yeah.
I get asked a lot, like, does skincare really work? What should I use? What really works? And, I tell people, well, look around. I mean, see what people look like now versus what they did 20 years ago. So we can see that it's working.
Absolutely,
and not everybody's doing surgery. So I like to say it's the whole toolkit, right? It's the, it's the injectables, the lasers, surgery, skincare. It's, sort of finding for you the best balance of all of those things and making them work together.
Yeah.
I think one of the things that affects us a lot is, we're we've become such a visual society. So we're all on social media and we are constantly seeing whether it's influencers or celebrities. And, there is this trend of celebrities on Instagram who are, 60, 70 and look amazing. And I'm curious for celebrities like a Demi Moore or a Vera Wang or Michelle Pfeiffer, they all look amazing. What are they doing?
I don't know for sure. But I think they've had good surgeons, and I think they've done some non-invasive things to improve, keep the quality of their skin good and healthy. And I know, Demi, exercise has been important for her, healthy diet. What I can say is, salt, sugars, including alcohol, not good for collagen. So
Did everybody hear that?
Yes. Yeah. No, it's true, but it's true. And even, if you think of the liver as our main organ that's helping kind of clean our system, we want it to work really optimally, and the healthier that is, the healthier we are, really. So, but I would imagine that it's a combination therapy.
It feels too like you can't just do nothing and then one day wake up and say, I'm going to do this one thing and
it's better if you don't. I do come across patients every once in a while who are sort of waiting, and it's better if you don't. You should do little things all along the way, but without losing sight of who you are and what the goal really is. And because sometimes we can look at one thing too much, and it's then becomes a distortion, and we don't want that. So it is balance, but it is about doing the right things at the right time.
Yeah, I agree with that. Do you think there will ever be a time when machines replace surgery?
Oh, I sort of is there another universe? Probably. I mean, maybe, yes, maybe, but I don't know when that will be. I do think that technology will probably influence surgery as well, because what we can't accomplish with technology, we'll still be using surgery for. But I have to imagine the answer would be yes. But what's hard about all of these things is we sort of have a thing of the moment, whether it's, hormone replacement or, something else. And we think, yes, that's it. That's the thing. And then a few years go down the road and we're like, well, it's not really the thing. And we didn't really expect this part of it. And now we're seeing that. And maybe it was too much of that thing, So it's hard to think in sort of the fourth dimension. It's hard for humans too,
Yes.
So that is the thing about these technologies is they're kind of in a more linear way. We have this, we're doing one thing with this machine and we're doing something totally different with that machine. And right now, at least, we haven't found a way to combine all those things to have the one device that's going to do everything, So I feel like that may be a long way away, but I would have to expect one day.
Yeah, one day maybe
we'll figure it out
curious.
and start thinking in many dimensions. Yeah.
So interesting. What would you say is sort of the most popular surgery that people come to you for? Well, I mean your face. So
Yes, yeah. So I think eyelids for sure. And they come with patients who've been bothered by it for a while, usually, maybe because they had trouble putting on eye makeup or they feel like their eyes are getting smaller. And when done well, boy, are they happy, because the actual procedure wasn't that taxing to recover from. Many cases, if it's, the uppers and like a limited amount on the lower, we can do that under local anesthesia in the office. So I think that is both popular and, is seen in the younger patient who might have a hereditary, need for that because it just runs in their family that they get extra eyelid skin early. But it also is in the middle-aged and the older patients as well. So
yeah, I think that's like a fairly easy surgery with a good payoff.
Mm-hmm. Yeah, definitely. Because again, the amount of time in, the ease of recovery when done well, people are usually very, very happy.
I'm curious too, like what you see or if you have to address, ethnic differences, like are African American skins different in terms of surgery or Asian skins, or like how does that?
And it's with all ethnicities, there are many aspects to think about. One is just having someone preserve their ethnicity so for example, for rhinoplasty or nasal surgery, having their nose look better and be in harmony with their face without taking away their ethnicity. That's a huge thing now that maybe in the 80s wasn't a concern. Maybe in the 80s, doctors were kind of giving everyone the same nose, and we're not doing that now. But also the skin thickness can vary depending on your ethnicity, and the strength of cartilage can also vary. So on many levels, there are differences that, we have to be aware of and take into consideration when we're trying to restructure a nose in particular. But when it comes to the face, it's in the way people heal also. And that can vary depending on how much pigment you have in your skin, or I even find very fair patients sometimes lose color in their scars. And we can do things to intervene early that may help them heal more optimally. And that may be a subtle detail for some patients, but it's important.
And I find that so interesting. Let's say you want to do something, probably eyelids, but you don't have a big budget.
Oh, yeah.
How would you approach your care?
What I like to do for patients is to, one, find out what bothers them the most, and the second, to make sure I can make recommendations that are going to put them in the positive, but also make them feel good about what they're doing. Because I hate hearing stories of patients leaving an office feeling like they were under the gun and now they have all this stuff to do and how will they afford it. That is a consideration, and you want to always do something that's, again, helping you address what bothers you, but also something that's reasonable for you in the least expensive things that can improve your skin, for example. Chemical peels are been around forever, but they are really, really effective. There are some topical agents that are more prescription strength that can improve color and cause deep exfoliation. And there are some lasers or things that people can recover from easily that can be done over time, sort of as maintenance, that can put them in the positive. And if it's really surgery because of whatever it is, then it depends on, you can place priority, you can do it a little at a time. It doesn't always have to be everything all at once. Right. So I think we try to, meet the patient where they're at and make recommendations accordingly.
Amazing.
Yeah.
What do you love best about what you do?
Oh gosh, making people feel better, honestly. I think even if they leave my office without having done anything, I want them to feel better and feel, more confident and connected with themselves. Because another thing that has come out a little bit more now is the role of our subconscious and how we heal, and making people aware that they're kind of involved in their own care too, I think is empowering for people. And so, yes, ultimately, if I do surgery and it looks great and they're thrilled and they're just carrying themselves better, that's like a home run for me and really makes me so happy.
I love that. That's really great. Well, I think that's a perfect note to end on.
Okay, great. Thank you so much for having me.
Thank you so much for being here today. This was fascinating. So thank you to Dr. Ann Klausner. And if people want to find you, what's the best way for them to?
They can find me by email at www.klausnerinstitute.com, or they can just Google Dr. Lee Klausner.
Amazing. Well, she's amazing. And if you go to her website, you'll see some incredible before and afters, and go make an appointment to get a consultation. So thank you. And that was Going Golden.